I wasn't myself. And normally I have so much energy. So I knew something was a little off.
At the time, this Kaneohe woman was diagnosed with the flu, but now she believes she may have actually contracted the coronavirus. And she's not alone, according to a study in Journal of American Medical Association. The actual number of infections in the U.S. could be 10 times higher than what's being reported. Researchers think many cases were not reported because people didn't realize they were infected with COVID-19.
And to put the numbers into perspective, the Department of Health reports nearly 30,000 cases of COVID-19 in Hawaii since last February. Using the formula from that study, that suggests that nearly 300,000 people in the state could have possibly been infected without even knowing it.
And as it turns out, what many people thought was an urban legend may actually be true. If you got really sick after receiving your first dose of a coronavirus vaccine, chances are that you probably had COVID-19. KITV4's Diane is in the newsroom now to explain why that might be the case. Diane.
Mika, some people are convinced they were infected with the coronavirus last year simply based on their symptoms and how long they were affected by it. In many cases, it lasted much longer than the flu. Now some of those people are finding out they may be right. This is Kaneohe resident Julie Aragaki vacationing in Las Vegas last February, a day before she got really sick.
Chills, runny nose, coughing, body ache. It was like I was miserable.
She went to the doctor and they told her she had the flu.
They said that I was tested positive for influenza A. And at that time, they said that if you have influenza A, you can't have COVID. So I was like, okay, well, that's good. I don't have the virus.
The entire time, she thought she was COVID-free until she received her first shot back on March 3rd.
For 2 weeks, it felt like I was hit by a bus. Like I didn't have the energy to do anything.
Dr. Bennett Louie, chief of internal medicine with Hawaii Pacific Health, explains what happened.
Getting a strong reaction to a first COVID vaccine could be a clue that you may have had COVID without knowing it, especially early in 2020 when we didn't have a lot of testing available. Because your immune system is already ready to respond to the virus, and getting vaccinated brings that response back strong.
That's why most people get sick after the second shot.
That second shot of getting, the Moderna or Pfizer vaccine is often associated with a stronger reaction because your immune system has been primed by the first shot. And so your antibodies are starting to kick in, and when that second shot hits you, it seems to be more common to get a low-grade temperature, body aches, and flu-like symptoms for a day or so.
Aragaki says she was fine after her second shot. According to Dr. Louie, people should still get inoculated, even if you know you had the coronavirus before.
If you had COVID-19, we still recommend getting the vaccine because the natural disease doesn't guarantee that you have the same protection as getting vaccine. The vaccines were thoroughly tested, and we know what they can do to help your immune system fight off another infection.
Aragaki may be fully vaccinated now, but she plans to keep practicing safe habits like social distancing and mask wearing.
I used to always get sick, and ever since the mask mandate, I've been really good. So I truly believe the mask really helps protect you.
Dr. Louie says he and his team at HPH think there are a lot of people who fit this category, but he emphasizes this is a theory, not a published study with any scientific proof. The Department of Health disagrees with Dr. Louie. It says it is aware of this theory, but does not see it as a reliable indicator of whether or not you were previously infected. Live in the newsroom, Diane, KITV4 Island News.